In this recording, you're going to hear from myself and other representatives from the Department of Human Services and Pennie, and we'll give an overview of what the continuous coverage requirement is and what the unwinding will look like over the next year, the Medicaid and CHIP renewal process, our communications and outreach strategy, and how you can help Pennsylvanians stay covered. Now I'll turn it over to my colleague, Carl Feldman from the Department of Human Services, Office of Income Maintenance.
Thank you, Allie. This is Carl, and I'm going to be sharing some information around the background of the end of continuous coverage. You may know that a federal public health emergency was declared in 2020 as a result of the coronavirus pandemic. Congress passed a law at that time that made it so that states could receive additional Medicaid funding as long as they maintained coverage for people enrolled in Medicaid, regardless of the actual status of their eligibility. This is known as the continuous coverage requirement and has been in place in Pennsylvania. Since March of 2020, despite the fact that we've been maintaining people in their eligibility, we have continued to send renewal paperwork and use the information provided. But cases were not disenrolled as long as throughout the public health emergency. As of the beginning of 2023, 3.6 million people have been enrolled in Medicaid. This follows national trends around growth of the Medicaid program. We know that among those 3.6 million people, there's approximately 617,000 that have provided information demonstrating that they are no longer eligible, and an additional 577,000 which have not submitted a renewal at all. As was stated, during this time, those individuals have been maintained in their eligibility under the continuous coverage requirement. At the end of 2022, Congress passed the Consolidated Appropriations Act of 2023, which separates the continuous coverage requirement from the public health emergency. And continuous coverage will end on March 31st of this year. That means that the state will resume pre-pandemic renewal processing as of April 1. We want to make sure that everyone understands that despite this change, all individuals will have an opportunity to have their eligibility reviewed over the course of a 12-month period. There is no rush to have all renewals completed on April 1, and anyone who has been maintained in their eligibility will have no negative action taken on their case until that renewal is completed. No one will immediately lose coverage as a result of this change. We do have the ability to renew coverage based on information we have on file or through exchanges with other programs, and we may renew eligibility as a result of that before paperwork is issued to conduct a renewal. Now I'm going to hand it off to my colleague to talk about the renewal process.
Thanks, Carl. This is Lexi Dysonroth, Executive Assistant for the Office of Income Maintenance, and I'm happy now to take the opportunity to talk about what communications Medicaid and CHIP recipients will see on their journey to renewal. Located on this slide, you'll see some lists on timing of what that looks like for an individual that's expecting a renewal. Medicaid recipients receive a renewal every single year. It's a regularly scheduled action needed to maintain eligibility. We've added some communications during the unwinding period to emphasize the importance of completing that renewal, as the last couple of years have taken us away from enforcing that regular process. So let's walk through these communications. So at a very basic level, communications start 90 days ahead of that renewal. So for example, an individual with an April renewal with a date of April 30th as the renewal date that fall at, and just for general reference, renewal dates fall at the end of the month. They will start to receive communications in the month of February regarding their renewal. They would have received the change reporting flyer you see here, as well as a text, an email, and a helper call or blast call from DHS. This month, in March, that same group will receive the 60-day communications before renewal. That includes a letter giving them information to renew early, a text, an email, and another helper call. Again, those are the blast calls. And now we've reached the month of renewal, or what we consider the 30-day before renewal bucket for communications. And in this month is where the individual will be receiving the renewal packet itself and also some text reminders. We'll break these down further on the following slides, but before I head there, I want to add in one other point with these 90, 60, and 30-day communications. As Carl mentioned before, we're going to undergo a 12-month renewal process for the unwinding. It's worth mentioning that these renewals happen every single month. So that also means these communications are going to layer on top of one another for different people with different renewal months throughout the unwinding. For instance, the example I just reviewed was for April renewals, but what this could look like in a month progression feels like this. In the month of February 2023, 90-day communications will go out for April renewals. In March of 2023, 60-day communications will go out for April renewals, and 90-day communications will go out for May renewals. In April of 2023, 30-day communications will go out for April renewals, 60-day communications will go out for May renewals, and 90-day communications will go out for June renewals. This rotating progression continues throughout the unwinding. And with that, I think we can head to the next slide. So, as I mentioned on the slide before, communications really start 90 days before the renewal is due. So the message is that the individuals will start to see surrounding a call to action to check or update their contact information. This will ensure that communications get where they need to go for somebody to be fully informed and complete the actions needed for renewal. And we can go to the next slide to see what some of those communications look like. These are some examples of what we have available for MA and CHIP recipients starting at the 90-day point. All of these communications are outlined at dhs.pa.gov/PHE under the heading MA and CHIP recipient communications. With that, I think we can move over to those 60-day before renewal communications. Here, we see key messages reminding individuals of their upcoming renewal, encouraging early completion of that renewal through Compass, over the phone, or in person. We want recipients to be able to renew in any way that is available to them. These members will receive, again, that mailer telling them what is needed to renew. That also includes an FAQ about the renewal process and how to start the renewal early. Additionally, they'll receive that helper call or blast call with the phone number on with their phone number or file, and a text message and email outreach with the same message. If we could go to the next slide, we'll check out what that looks like. So those 60-day communications are listed here, again, available at dhs.pa.gov/PHE. And we move into the 30 days before the renewal is due. Here is when the renewal actually comes. The messages here are complete the renewal now. They'll get the packet with information on how to return the forms and how to do so in other mediums. Additionally, text messages will go out and nudge individuals as their deadlines approach. They'll receive one text message nudge when the renewal is mailed and another if the renewal isn't processed 5 days before it is coming due. And let's take a look at what those look like. So again, available at dhs.pa.gov/PHE under Medicaid and CHIP recipient communications. You'll see examples of those communications and what they look like for individuals. And after a renewal is due, following that renewal processing, the household will receive an eligibility notice, whether they are still eligible for Medicaid coverage or CHIP at their current cost level, as well as appeal and reconsideration processes. If someone's ineligible, information will be securely and automatically transferred to Pennie, which will begin outreach to that household. If they don't complete a renewal, households will receive a mailing informing them of the ability to return that renewal late and avoid a loss of coverage. That information is also going to be given to Pennie. The outreach between DHS and Pennie and the partnership we've developed in this effort to keep Pennsylvanians covered has been a true pleasure. And with that, I think I'm going to pass it over to Chachi Angelo at Pennie.
Thank you, Lexi. Chachi Angelo, Director of External Affairs with Pennie. And just a quick background explanation of what Pennie is. Pennie is the official health insurance marketplace for Pennsylvania. We transitioned away from healthcare.gov in 2021 when this continuous coverage requirement was happening. So I always like to at least start with the awareness of Pennie because we're dealing with a population that has never really had to know Pennie. So now that folks will be either being rolled over to Pennie, it's important to understand what Pennie is and how we help. Pennie and Pennie.com, the official health insurance marketplace for Pennsylvania and the only source for financial savings to help drive down the cost of coverage and care. That financial savings, also known as a tax credit, or a tax credit that can be used immediately. So in the end of the continuous coverage requirement in our work with DHS, as Lexi alluded to, there are two populations. One that reply to their renewal packet and are deemed ineligible for Medicaid, and those that do not reply to their renewal packet. And I'll start with the first one. So if a person is financially ineligible for Medicaid, their information automatically and securely sent to Pennie. Pennie will then generate a notice that will go through the mail and also email with an access code to claim their Pennie account. Based on the information that they provide to medical assistants, we're going to be able to give them an estimate of how much financial savings they'll be able to apply to a quality health plan, and then also their enrollment deadline. And we are encouraging these recipients to enroll within the first 60 days so that there isn't a gap in coverage. And Pennie will continue the outreach to this population with follow-up emails and perform outbound calls. One thing to also mention with this population is that since we're able to create a Pennie account on their behalf, submit an application on their behalf, and set up their enrollment deadline, we're giving these individuals a head start into simply choosing a plan and staying covered. The second population, if someone does not return their renewal, their information will be sent to Pennie when their MA closes. That's when Pennie will pick up our outreach based on the communication avenues that DHS shares with us. We're going to be sending out a co-branded letter that will be branded with DHS, CHIP, and Pennie logos to show that warm handoff, and also following up with emails and outbound calls. So if we jump to the next slide, we can talk about some policy initiatives that are going to help us make sure that Pennsylvanians stay covered. Now, Pennie created an extended 120-day special enrollment period. Normally, for any qualifying life event, such as a birth, a change in insurance, a move to Pennsylvania, those types of qualifying life events normally are only 60 days. As we understand, this population may find out late that they do not have coverage, so we wanted to really allow for more time for these populations to enroll in quality coverage through Pennie. That's why that we have an extended 120-day special enrollment period. But again, customers are highly encouraged to enroll within the first 60 days of losing MA coverage, so there is no gap in coverage. Also, as I mentioned, we'll be submitting that application so that these customers are able to jump right to choosing a plan. All they have to do, use that access code, come into Pennie, check to make sure the information is correct, and then choose a plan. And one thing that is very important is that Pennie works with MA and CHIP. So no matter what door a customer comes through, either MA or CHIP or Pennie, we have a no wrong door policy that will make sure that Pennsylvanians get the coverage that works best for them. If we could just jump to the next slide. Just to ground set that obviously health insurance is not an easy thing to navigate. I would put taxes and health insurance up there as like the two things you don't necessarily want to talk about or deal with, but it's a necessity. So Pennie is here to walk somebody from confused to covered. And we can help in person, by phone, virtually, and in one's preferred language. A lot of different ways to get help. First, our Pennie customer service line is staffed and ready. We are fully staffed, even outside of our normal open enrollment period, with customer service reps that are ready to assist customers in Pennsylvania. And we also have Pennie certified assisters and brokers that can help somebody no matter where they are in the process. And assisters and brokers, they are friends, neighbors that are in your community that can help somebody through the enrollment process. And you can find those assisters and brokers at pennie.com/connect. And then at pennie.com, we have a wealth of information for the do-it-yourselfers. So you can find FAQs, video tutorials there, and it's very simple, pennie.com, PENNIE.com. And I think I'm passing it over to Allie. Thank you.
Thanks, Chachi. So as we've talked about, this is an incredibly important effort that's going to take place over the course of 12 months. So we want to make sure that we are both building awareness of the importance of completing your renewal on time and catching people when it's time for them to renew. To help assist this, we are going to be engaging in a long-term advertising and grassroots outreach strategy to reach people across Pennsylvania. Our advertising is going to focus on multiple channels and platforms. We will be on television, streaming services, radio. We're going to leverage outdoors advertising through billboards and mass transit, and digital media platforms like social media, streaming services that I've mentioned, Google search, and others. We're going to focus on reaching diverse populations and leveraging media outlets that might serve different communities specifically. And we're also going to be working very closely with our partners at Pennie, as we've been doing throughout this process, to make sure that people are seeing similar messaging across different resources. Chachi, do you want to add anything on the advertising side before we go into our grassroots effort?
Yeah, so DHS is doing their advertising campaign, and then Pennie will also be doing an advertising campaign. Statewide, traditional media such as television and radio, and out of home, digital as mentioned here, and then also some lifestyle kind of ads where you might see the advertisement in a laundromat, in a pharmacy, which is where folks might find out that they've lost coverage first. So we want to make sure that we're developing awareness within the pharmacies, but then also places where folks might have more time, like I mentioned, laundromats, nail salons, and barbershops. So, and then also finding those niche multicultural media partners that specifically target historically vulnerable communities.
Thanks, Chachi. And as I mentioned, we're going to be doing some grassroots communications as well, focused towards different communities, trying to meet people where they are. We're going to be working with health centers, community organizations, other community hubs like bodegas, barbershops, trying to catch people in different parts of the community. So if they have questions, if they're reaching out to say like a faith leader in their community, a food pantry, anywhere, they might be able to get directed to what they need to know about Medicaid and CHIP renewals. We also have a wealth of information on our website about this. I know we've covered a lot today. So as you digest this information, as you have additional questions, I would encourage you to go to our public health emergency hub of information, that is dhs.pa.gov/PHE. On there, you'll find an overview of what is happening and how people can prepare, what they need to know. You'll find information on how you can sign up for our helper listserv, which you will hear more about in just a few moments. Our communications toolkit, a glossary of terms that are used around this. I know as a government, we can be a bit bureaucratic and wonky. We want to make sure that people understand what we are talking about when we say things like renewal and unwinding and public health emergency. We have some frequently asked questions and answers, other webinars and videos that have been recorded throughout the last year or so that can help you as you prepare for this. and the schedule of the communications that will be sent to Medicaid and CHIP enrollees as they renew. These are what Lexi walked through earlier, the letters and text messages and other forms of outreach that'll go out at different points through a renewal process. So as we embark on the unwinding process, we are obviously trying to do a lot of outreach from the state level through DHS and through our partners at Pennie and other partners around state government. But we know that we can't be the only messengers here, and we're hoping that if you're watching this, you can also help us out. As I mentioned a few moments ago, we have a very robust communications toolkit on our website at dhs.pa.gov/PHE. That toolkit breaks down some of the main messages here about how to keep your contact information up to date, how to complete your renewal, what to do if you are losing coverage to Medicaid, how you can get the Pennie or CHIP, or if you are Medicare eligible, resources that are available for you there. And then also just a general information overview of what is happening over the next few years, because we know we are returning to pre-pandemic processes that might be entirely new or unfamiliar for some people. So we have a few resources that I think capture the most urgent overview of what is happening and what people need to know. They're detailed on the slide. There's a couple of flyers that can also be used on social media. There's social media specific resources, and then there is newsletter text that you can send out either in an email blast, you can use in any way that whatever communications channels. These are a few examples of what I've mentioned. Like I said, we have a 2-slided flyer there that is the Medicaid and CHIP renewal flyers. We have a smaller, this could be like postcard size, renewals are coming flyer, and then a number of social media graphics and post text. And a lot of that is translated into Spanish. If you need additional languages, there's information on the toolkit page about how you can reach out to the DHS communications team, and we can try to get those for you. Again, this is how our toolkit is broken down. Like I said, we have general information, we have resources about updating your contact information, completing your renewal early, what to do when your renewal is due, and then what to do if you are not eligible for Medicaid. Like I said, anybody can use these. If you have a listserv that you can send out to people who might be affected by this, if you want to share on your social media or on your website, we want to get these messages out as far and wide as possible, and we want to make sure that we're all using the same messaging here. So that's why this toolkit is available to help you do this and to make sure that we are getting good and accurate information out there as quickly and broadly as possible. So we're building awareness over the next year. We're going to turn it back over to Lexi for the next slide.
As you mentioned, accessibility is incredibly important over the next year. With that foresight, we came up with the Helper Portal in Pennsylvania. DHS has managed a listserv created specifically to create that awareness by educating and sharing our resources related to the unwinding and Medicaid and CHIP renewals. This site collects our robust network of individuals that have accepted a call to action to sign up and receive information and maybe help us out in this mission of ensuring the unwinding information gets to individuals when they need it. This can be state and local officials, community organizations, managed care organizations, healthcare providers, government organizations, and really anyone and everyone can be a helper. Through this portal, DHS will share regular updates, those resources that Ali had mentioned too, that are coming timely in the unwinding, and also calls to action to spread the word. To become a helper, simply visit dhs.pa.gov/PHE and click on the box that says Become a Helper to get on the list. We have additional information in case you missed it, and you'll be able to catch up on everything that we've sent out so far through this portal. So I encourage you, visit dhs.pa.gov today and become a helper. Sending it back to Ali to close us out today.
Thank you, Lexi, and also thank you to Carl and Chachi for being a part of this today, and to all of you for taking time out of your days to watch this. As we said, this is going to be an incredibly important effort over the next year, and we want to make sure that we are keeping Pennsylvanians covered, whether it's through Medicaid, CHIP, or coverage through Pennie. And each of you can help make that possible. So please use those resources that we mentioned at dhs.pa.gov/PHE. Sign up for the helper portal for more information and continue to look for updates over the next year. Thank you in advance for your help and your support.